Hello guys, welcome to Basic Nursing Classes. Myself Amanpreet. In today's video, we are going to discuss about the disorders of thyroid gland, and firstly we are going to discuss about hypothyroidism. Okay, so let's move on with this topic. This topic is very important from exam point of view. Okay, basically, hypo means decreased secretion of something. So, obviously, in hypothyroidism, there will be decreased secretion of thyroid gland. Okay, thyroid gland hormones. So, it is thyroid gland is under secreting the hormones. So, it is under active thyroid gland basically. Okay, firstly, we should normally know what the thyroid gland does. Thyroid gland, it is situated below the larynx, that is the voice box of a body. Okay, and it is butterfly shaped. Okay, and it basically secretes T3 and T4. The other names of T3 and T4 is triiodothyronine, that is T3, and T4 it is thyroxine. Okay, the main hormones which are secreted by thyroid gland are T3 and T4, and one more hormone is there, calcitonin, but that is not so important. The main hormones are T3 and T4, and we measure their levels by doing the blood test. Like, we can measure whether the thyroid gland is secreting these hormones in the normal level, so we can check by a blood test. And the body needs iodine to produce both these hormones. Okay, because iodine is very necessary to produce these hormones. If the person is not taking iodine via his food, okay, so there will be under secretion of these hormones, because these hormones cannot be produced without iodine. Okay, so this is very important to remember. And T3 and T4, what they basically do in our body, basically thyroid gland hormones, these are very important for the metabolism. The first main action, it is responsible for the metabolism of fats, metabolism of carbohydrates, metabolism of proteins. So every type of metabolism is regulated by T3 and T4. Okay, plus this hormone is basically responsible for thermoregulation in our body, that is temperature regulation, the inner temperature of the body, which is regulated by thyroid gland. Okay, and moreover, it is responsible for the growth and development in children and the young age, like in the persons who are at puberty age. So it is basically responsible for the growth and development of bones, of muscles. Okay, so it maintains the body weight, okay, of both males and females. It determines the energy levels in a body, because it controls the metabolism, so it controls the energy levels. Okay, plus it is responsible for the growth of hair, of nails and bone growth. Okay, and thermogenesis, that is temperature regulation. So these are the basic uh, responsibilities, the basic things which are controlled by the thyroid gland hormones. Okay, and the main source of iodine, which we need in a body to produce these hormones, these sources are mainly, we take it by food. Okay, the food source is the main source of iodine intake, especially the seafood. Okay, or you can take the example of iodized salt. Okay, and moreover, the secretion of T3 and T4, it is regulated by TSH levels. Okay, that is thyroid stimulating hormone, which is secreted by interior lobe of pituitary gland. Okay, the TSH hormone, which is secreted by pituitary gland, it regulates the secretion of T3 and T4. when the body needs T4 and T3 and T4, then the pituitary gland secretes TCH, okay, which stimulates the secretion of T3 and T4, okay. And in hypothyroidism there is decreased level of T3 and T4, but there will be increased levels of TSH, okay, because the pituitary gland will be stimulating the thyroid gland to secrete more and more T3 and T4 because of decreased levels of T3 and T4 in the body, in the blood, okay. So their relationship is reciprocal, okay. And let's move on to the sign and symptoms of hypothyroidism, because these hormones are responsible for metabolism, okay. So there will be impaired metabolism. The first symptom can be weight gain. The person has impaired metabolism. Everything will go down in hypothyroidism. There will be bradycardia, okay. There will be constipation, decreased gastric motility, okay, which can lead to constipation. The person will be having puffy face, and he will be having weakness because of decreased energy levels, fatigue, okay, and cold intolerance. The person cannot bear the cold, okay. Moreover, coarse dry skin because of impaired metabolism and impaired temperature regulation, okay. And plus the growth hormone, the growth of hairs and nail will be impaired, so it will lead to hair loss, or the hair will be brittle, okay. And menstrual irregularities, which can lead to infertility, okay, or confusion or forgetfulness. There will be memory loss, there will be slurred speech, okay. So everything will go down. There will be joint pains, okay, because of impaired metabolism, okay. And infertility, obviously, because of menstrual irregularities. And enlarged thyroid gland, that is also known as goiter, okay. The because of decreased T3 and T4, the thyroid gland will swollen up, it will be enlarged, okay. And plus, moreover, in severe state of hypothyroidism, there can be some other more critical signs and symptoms, like decreased level of consciousness, because everything will go further down. There will be decreased loss of consciousness, there will be extreme lethargy, okay, there will be extreme hypothermia, bradycardia, hypotension, and stupor condition, which can lead to coma. And there will be hypoventilation. Because of coma and hypoventilation, the person can also go into respiratory failure, okay. And a respiratory failure, it's an emergency condition because the person cannot breathe so properly. There will be impaired oxygen saturation and impaired level of oxygen in the cells, so there can be chances of endotracheal intubation, okay. So this is very uh, critical condition, and that condition is known as mixed edema coma. And this condition is very important from exam point of view. It's a severe state of hypothyroidism, okay, when the level of T3 and T4 in the body that goes too much down, okay. So in that condition, it's a very critical condition. The person can go even into respiratory failure, and we have to intubate the patient, okay. The person can go on artificial ventilation, okay. Now let's move on to the causes of hypothyroidism. So why the thyroid gland is not acting too much, it's is under secreting, why the thyroid gland is active. The first reason can be autoimmune disease, okay. The autoimmune disease, it's also Hashimoto's disease, it's also known as Hashimoto disease of thyroid gland. And autoimmune, because the body cells are itself destroying the thyroid gland. Okay, the other cause can be any treatment for hyperthyroidism, the condition in which the thyroid gland is extremely extra secreting the T3 and T4 hormones. So in the treatment of hyperthyroidism, it can lead to hypothyroidism. Okay, and other reason can be radiation therapy, like in the cancer of head and neck. Okay, in that case is the radiation therapy that can damage the thyroid gland. Okay, then if the thyroid gland is damaged, it can lead to under secretion of T3 and T4. Plus any surgery of thyroid gland in which there is removal of any thyroid gland part, that can also lead to decreased levels of T3 and T4. And some medications, for example lithium is basically prescribed in the patients who are suffering from any psychiatric illness. Okay, and moreover in pregnancy, so pregnancy induced hypothyroidism. In what happens in pregnancy, there are some antibodies are produced in the body which can damage the own gland. Okay, so these antibodies, because they damage the own glands, that can lead to hypothyroidism. Okay, and hypothyroidism in pregnancy can lead to some risk of miscarriage, preterm delivery, and preeclampsia. Okay, so we have to treat the pregnancy induced hypothyroidism. And moreover, if the person is deficient in iodine deficiency, the person is not taking iodized salt, or the person is not taking the foods which are rich in iodine, for example seafoods. Okay, the seafoods are rich in iodine, and it's very essential to take the foods which are rich in iodine. Okay, so these are the basic signs and symptoms and causes behind hypothyroidism. In the next video, we will be talking about its management and any complications of hypothyroidism. Okay, so good luck. Thank you.